Next, I invite Dr. Jijo Joseph for his talk on tips for a scarless surgery. He has completed DNB in plastic surgery with a national gold medal, hand surgery fellowship from St. Andrews Hospital, UK, currently working at Mitra Hospital, Malabar Medical College, Kozhikode.
Good morning. I'm Dr. Jijo, and I'm going to talk about the tips for scarless suturing. So many of the topics, many of the points that I'm going to discuss here has been already discussed. So we'll just brush through a couple of points. Now, by scarless suturing, we mean the scar minimization techniques, or the techniques by which you can reduce the incidence of a bad scarring. Scarring is definite, but there are certain ways by which you can reduce the occurrence of scarring. So these are the type of suturing that you can use. For me, personally, it doesn't matter what kind of sutures you use. I prefer interrupted simple sutures. You could do subcuticular or absorbable as well. The alternate techniques to suturing include adhesives and tapes. So adhesives are the substances that you apply on an already opposed wound margins to keep it in place so that it heals better. And tapes are the substance that helps to keep the wound margins together. So if you can oppose the wound margins together mechanically, there are different ways of doing it. You can apply the tapes or steri strips on the top so that the wound heals properly. So by using these techniques, you can basically avoid the skin sutures on the top. So many parents will be very worried about placing sutures on the skin margins. So these are possibly the techniques that you can use so that you can avoid sutures. Now, I would say these are the more important points when you consider suturing, the intraoperative considerations. So in a trauma setting, you need to freshen the skin margins, and if it's an elective operation, the site of incision placement is important. And additionally, you need to handle the tissues in an atraumatic way, and you have to use the appropriate instruments and adequate size sutures. Now let's see a bit more on the site of incision placement. Now you have seen that when you place an incision, it has to be along the natural creases. If you look at the forehead, you could see the creases are in a transverse manner. So if you could place the incision along it, the resultant scar will be much less conspicuous. Secondly, when you place an incision, you have to make sure that you does not cross the facial subunits. If you look at these diagrams, you could see so many facial subunits. Now, that also goes with the same principle. When you cross a particular subunit, you are likely to cross the natural skin creases, which could eventually lead to a bad scar. Thirdly, you have to avoid excessive tension during suturing, which could potentially lead to skin margin necrosis and eventually a delayed wound healing and a hypertrophic scarring. So how could you avoid excessive tension during suturing? You could use a local flap or a full thickness skin graft, or you could do adequate undermining so that you could close it without tension. Now, this gentleman came to my OPD with a sutured wound in his lower eyelid, resulting in an ectropion of the lower eyelid. Now, we recreated the defect and covered the defect using a full thickness skin graft from his post-auricular area. Is that it? Is there anything more to the suturing techniques to avoid a bad scar? Yes, I would say the post-operative management is as equal as the intraoperative management of a wound. In this, the most important aspect is a good scar massage. Secondly, you can use a scar gel or scar sheet, which essentially contain the silicone. So the substances that are included in the scar gels or scar sheet essentially block or lock the moisture within the wound that helps to reduce the inflammation and also help to remodel the collagen so that the scar will be smooth and the extra proliferation of the collagen fibers will be arrested. And that's all for today. Thank you. Yeah, please. Yeah. So I mostly use Hexalac Ultra
Okay.
or Contractubex. There is a smaller, less costly version of it. It's called as Silinoscar gel. So it's basically a bit less costlier compared to the other brands.
Similarly, for this hypertrophic scars, I mean, do you advise intralesional trichodes, 5-fluorouracil? What about your?
Yeah, the occurrence of this hypertrophic scarring is less predictable. So the first thing that we say post suturing is to do a good scar massage. We start the scar massage in around 10 to 14 days, and we ask them to wait for 1 month.
Okay.
So in a month's time, if you see that the scar is proliferating, we advise them scar gel and again wait for another 3 months. Most of the scars will resolve. In case if the scar is not resolving with a scar massage or a scar gel, we advise a Kinacot injection. Yeah.
Thank you.
Can you elaborate on scar massage, how it is done,
Yes.
how long?
Yeah. So you need to do a proper scar massage by which I mean you have to apply good amount of pressure on the scar. So the advice that we give in our institution is scar massage for 5 to 10 minutes twice daily. So some people ask, okay, sir, is it okay that you do once daily or many times a day? So I would say if you could do more frequently, it's better.
After how long? After suture remove? I mean,
Yeah.
when to start?
10 to 14 days.
Okay.
We remove sutures in 5 days. Actually, the scar is the sensations over the scar will be less compared to the normal skin. So we just ask them to do massaging with Vaseline or coconut oil, liquid paraffin, or any moisturizer. As a matter of fact.
Okay. Thank you, Dr.
Thank you.
Jijo Joseph.
Thanks.